Meanwhile, as Kisumu welcomes visitors for the national celebrations and for the presidential tour, healthcare workers are raising concerns about a possible spike in Covid-19 infections. The gatherings in Kisumu amid a viral spread of the highly infectious Indian variant has unsettled even neighboring counties who fear that they could be caught in another deadly wave of infections. NTV's Helen Aura puts it into perspective.
Hours to the 58th National Madaraka celebrations, and medics have already raised an alarm over the ongoing gatherings in Kisumu, steered by none other than President Uhuru Kenyatta. But with crowds, gatherings and a disregard of the containment measures, laxity is the new normal. Frontline healthcare workers are now sounding the alarm.
As neighboring towns and counties to Kisumu County, I think we have a reason to be really worried, because we might be directly affected if the cases are actually going to increase, then they may spill over into this region.
These are just among the key concerns from the Kenya Medical Pharmacists and Dentists Union from the North Rift, who have also condemned the ongoing super spreader events that have been going on in Kisumu. Just recently, the president was thronged by crowds in Kisumu and Siaya counties, where he unveiled a number of projects in a whirlwind tour of the lakeside counties. The head of state has been accused of breeding impunity following these political gatherings where COVID-19 protocols have been disregarded.
We would want to urge the government and the 47 county governments to be very collaborative with us as we pursue to ensure that the health of our people and the welfare of our doctors in the stations of work, they are upheld.
Kisumu has in recent days recorded high numbers of daily infections, and with the ministry having confirmed the presence of the highly infectious Indian variant in the county, medical experts are concerned that leaders have placed politics over people.
Do not sacrifice public health good on the cross of politics. And I think that's a lesson that Kenya needs to learn. That India went on this path with campaigns, with disregard of public health measures, and also wanting to win the religious individuals on the side of the government, allowed religious functions to go on, knowing very well that these were against public health advice.
The Indian variant is in Kisumu. The transmission is more faster than the Wuhan variant that started circulating at the beginning of the pandemic. So such gatherings will actually encourage the transmission of the virus.
This is the reality, that we are going to face that surge without having vaccinated our people, which then brings the next question to say, how strong is our health system so that anyone who needs oxygen, anyone who needs critical care, anyone who needs a nurse, anyone who needs a bed can find it? The answer to that is that we are suboptimal. We don't have enough oxygen. We saw that in the last surge. And if this surge is going to be more severe than the last one, then it means that we need to make sure that we double our oxygen capacity.
If Kenya manages to vaccinate 60 to 70% of its population, then at least the nation can develop herd immunity. But until then, medics have advised for Kenyans not to be swayed by political leaders who will leave them in the cold when the infections surge.
Helen Aura, NTV.